My guest today is Pradeep Goel. Pradeep is the Chief Executive Officer at the selfcare Foundation. Selfcare, of course, is a blockchain platform for digital health networks. We'll learn all about this today. Welcome to the show, Pradeep.
Thank you very much. It's a pleasure to be here, and I'm quite excited to speak with you and your audience.
Fantastic. Very excited to speak to you as well. Pradeep, look, let's do what we do at the beginning of the show for anyone who isn't aware of who you are and what you do. And we'll get to self-care, of course, but let's hear a little bit about yourself first. Love it if you could please introduce yourself and share a little bit of your personal and professional story. You know, what have you been doing and how has it led you to self-care?
Certainly happy to. So I am through and through a healthcare executive. I have built a number of companies in the healthcare space. And over the years, I've had the privilege of working on public health projects that impacted millions of people in terms of access to care, quality of care. So I've been the CEO and COO and various other C roles in various health insurance companies, technology companies. And the net of all that is that I got to see healthcare from many different angles, from government angle, from insurance angle, from hospital angle, from patient angle, of course. So that gave me an insight into healthcare that most people don't have. I won't wish it for you to have that insight, but this is not an easy journey. And then as a parent, I have a child who needs a lot of healthcare right from the day he was born. And that brought a unique parent perspective on what it means when you have a child that needs continuous care. And then I'm also an IT, I'm an innovator. I like to solve problems. I'm an IT solutions guy, and I've always been in big scale IT all my life. I'm a recovering systems engineer, probably will never stop being one. So all those skills come together to give me a unique advantage or a unique vantage point in how healthcare works and how it should. My personal story is that I was pretty much, the healthcare executive that everybody loves to hate, CIO of an insurance company, doing the usual system implementation and building big data centers and running big operations and having a bunch of, top tier IT companies working for you and doing work for you and all that stuff. It was an easy place to be in that sense because I knew what I was doing. But after being 30 years in that space, I realized that, I'm not making a difference. I see the same issues year after year, decade after decade. I see the same disenfranchisement of the patient. I see the orthogonal relationship or the adversarial relationship between insurance and doctors. I see the distrust between patient and insurance. I see the employer's role becoming very convoluted and starting to be much and more complicated. And they are suddenly becoming stewards of healthcare rather than running a business. And I started to question, what am I doing? And especially when you have access to the kind of money I had, where I was able to invest hundreds of millions, if not billions, into IT, and yet I couldn't make a difference. I started to question, what is the purpose of me being a good IT exec? What am I doing? And then my son brought everything to light that even as a top tier healthcare exec with access to every healthcare institution and executive, I'm having trouble coordinating my child's care. So what does a parent without that kind of privileged access do? So that is my personal story, that I decided that instead of being healthcare, I need to fix healthcare. And that's brought me to what is now called self-care.
Yeah, fantastic. Well, thank you for providing some background, Pradeep. Maybe this is a good point then if you explain a little bit about what solve care is. And I suppose it would also be useful, when people think about blockchain solutions, we think about it in terms of, I suppose, the global context. But it'd be useful in this case when you talk about potentially trying to help the healthcare industry at a a multitude of different levels. Are we talking globally? Are you talking specifically US or specifically non-US? Or, these are that can be kind of figured out in the future. But yeah, let's begin with what self-care is.
So in a nutshell, if you were to try to say this in a very simple sense, what is Bitcoin? Bitcoin is self-custody finance. I own my own asset. You can't take it away from me. And this asset is not centrally governed, and it cannot be, I can't be locked out of access to my own bank account or equivalent, and so on. So Bitcoin is self-custody of finance, and self-care is self-custody of health. If we had the same autonomy about our own healthcare data, healthcare identity, and healthcare decisions, as Bitcoin is designed to give you custody of your financial well-being, then self-care is about self-custody of health. So that's the principle, the unifying principle behind everything we do at self-care. But how do you achieve something that, ambitious, and at the same time, what does it mean to a consumer? So self-care is a platform that embodies the core principles of patients' rights are sacred and sacrosanct, and patients should not have to ever trade their identity, their medical data, their rights for care. We should not have to say, well, for me to get care, I must sign forms that relieve me of my humanity or my human rights, that I should give up all my rights to my data and they can do whatever they want with my data. And when I sign up for an insurance company, they get to decide which doctor I see. And when I go see a doctor, they decide which specialist I can go see. All these constraints that are in healthcare that I was very much a party to either building those constraints or implementing those constraints, they are all artificially, this is not the way healthcare needs to be. There is no fundamental reason why I, as an insurance company CIO, should tell Andy which 32 doctors in his city he can see and the remaining 200 he can't. Who created these models? People like me in my old job create these models. And they're created for good, ostensibly, they are good reasons. Oh, this is economic reason. This is quality of care reason, whatever. But they are manufactured. So, same way as banks tell you that they are protecting you by not letting you withdraw your money in chunks greater than 500 pounds at a time while they're earning income on that. Yeah, they're protecting you, but they're also aligning that to the self-interest. So I'm not bad-mouthing banks, but they have a purpose. But I do believe that healthcare has become too removed from patient-centric thinking to enterprise self-interest. So if we do self-custody of healthcare, we need to build a platform where patients can manage their data, their identity, their relationships, their care, their medical records, their appointments, their payments, and everything else. So self-custody of healthcare is a little bit more complicated than self-custody of finance. In fact, by an order of magnitude more difficult, which is why so few companies in blockchain or not blockchain, Web3 and Web2, have attempted this. It's hard. Plus, you need to know how it actually works to be able to figure out how it should work, right? Which most people don't know how healthcare works. So in a nutshell, self-care is all about self-custody health. And we built a platform that services three fundamental transactions that a patient should be able to do without sacrificing their identity and their rights. One is to access care. The second is to pay for care. And the third thing is to coordinate care. Because everything ultimately boils down to these three things. Can I get to the right care? Can I afford or pay for this care? And can I coordinate this care with my family, with specialists, with pharmacy, with lab, with hospital, with outpatient clinic, whatever? Because healthcare is a team sport. You got to coordinate it always. So those three things are really, really hard to do in Web2, almost impossible to do well, which is why it's so frustrating an experience to be a patient. But on top of it, whatever experience you do get, you get that at the cost of your privacy and your identity and your rights. So we need to eliminate this trade-off, and we do that by bringing a self-custody platform And that's Self-Care platform. That's what we do.
Yeah, fantastic. Very well said, Pradeep. And it's a great way of understanding it. The way you talked about, it's self custody for your healthcare, really, or self care. And I think that makes sense because anyone dealing with any modern health system, and it doesn't really matter which country they live in. Obviously, some countries have better health care systems than others. But the reality is, if you are in the unfortunate position where you do need to negotiate your way around the healthcare system because obviously something's gone wrong with your health, then yeah, people understand what a nightmare that can be at the best of times, let alone at the worst of times, right?
Yep, absolutely. So, in terms of what we also focus on, and I know that the regulatory framework and the delivery framework for healthcare varies country to country, but the fundamental issues are the same. Because in all countries, the patient is essentially a recipient of care, and
Mm.
somebody else is giving care and somebody else is deciding what care to give. So you might have the NHS in UK, which is a great institution, but it makes a determination of who gives you what care when. You might be under the purview of an insurance company in the US who tells you which provider network you can visit and what procedures you can get or not and how much you will pay. Or you might be in a fully nationalized care model where the government decides, you know, based on your zip code or your age or your gender or your religion, which care you can get. And believe it or not, those are all factors that are used to determine what care you can as a patient get. So like finance, healthcare is highly regulated and highly controlled. That takes away all the power from the patient. So we always think of healthcare just in the context of, going to the doctor to get medicine or to get checked up, but there's so many other sides of healthcare. Who decides whether you can participate in cutting edge clinical research that might be a better care model for you than, let's say, getting surgery? Who decides whether you are eligible and whether you should participate in advanced cancer treatment? These are all decisions made by somebody for you, or if you even, and you probably don't even know about most of these decisions because they're not surfaced to anyone. So our mission and we have finished this task by and large, which is to build a platform where the patient's rights are restored. And if you want to deliver a healthcare of any kind, be it a pharmacy or a lab or a hospital, an insurance company, or individual doctor just setting up shop in Ghana, you can use a platform to build a direct-to-consumer delivery model. And the blockchain and the crypto is built into the patient's rights, their identity, their consents, payments, billing, appointments. Everything is on the chain in a manner that the patient and the doctor are both protected. So that's fundamentally, and you can be more than a doctor. You can be an insurance company. You can be a hospital. But when you join the chain, you join it in a role. And on that chain, then you can transact with other members, but you cannot take away their rights. You can service them, but you can't screw them over, is basically the principle.
Sure. And look, you said earlier, Pradeep, that, none of this stuff is easy. In fact, it's very difficult, right? So, how do you propose to get, I suppose, people onto the network? Because it sounds like you have got a great solution for individual patients and for healthcare providers alike. Um, but it's fine to build that solution. Of course, you need to get everyone to start using the solution for it then to become valuable and to start to grow at scale. So how do you propose, I suppose, to get there?
Yeah, so there are two ways. It's very simple. Either you can build a solution on the care platform, or you can use an existing solution and be part of that solution and start using it for your family. So in terms of building, any institution, any individual, any doctor, they can use what we call care labs and design their own subnet. And that subnet can serve a specific population or a problem. So if I am if I'm running so I'll give you an example. The subnet that we have just recently launched is called Care Trials. It's the first global decentralized DeSci project, DeSci net subnet, which allows any researcher in the world to publish their research on the platform and invite patients to join that research. So it breaks down all the barriers, which we can talk about that more a little bit later. But that's just one example of a subnet that's already on our platform, active, and you can just download the Care Wallet and invite people who are listening to download the Care Wallet from App Store or Google Play. So, and when you enter the Care Wallet, it'll ask you which clinical networks do you want to join, and you can choose Care Trials, join it, and it will show you all the cutting edge research happening around you, around, within 10 kilometers, within 20 kilometers of you, or you can look for, clinical research happening other side of the planet and see what's going on. Now, why is that important? Because as an example, my mom, she's about 80 now. Last week called me and said, we have a problem. I can't move. I'm literally, bedridden. She's a very active lady, travels around the world still. And she had very severe back spasms and couldn't get out of bed. So I rushed over and we went to the doc, and he said, you have a spinal deformation and we need to do surgery. And we're going to fuse some of your vertebrae, and that will take away this pain, but you will also lose some mobility. And she was like, I'm not willing to give up my mobility. I like traveling. I like working out. I do yoga. This surgery might relieve the pain, but I'm not willing to give up my life to reduce the pain. I'll rather live with it. So I started to research on Care Trials. I downloaded the wallet for her, set her up. And we found, within a minute, like 5 or 6 trials within 100 kilometers of Maryland, where she lives, where alternative to surgery is being explored, injections or very minimally invasive surgery using robotics. So, and all of these options are better sounding than let's fuse 3 of your vertebrae and really make you bedridden for the rest of your life. And she looked at that Care trials and she said, you know what? These trials are not yet ready for prime time usage. These products are still in development. But it looks like a couple of these trials are going to finish in the next 6 months. I am going to wait 6 months and see how these trials work out. And then I'm going to, get this advanced treatment, but I'm not willing to give up my life to get this surgery. The reason I tell you the story is average patient just listens to the doctor and is given these binary choices, which are not good always. Because every doctor she spoke to, and I was with her, basically said to her, either suffer the pain or lose your mobility. Those are your 2 choices. This is the known medical practice. Now, these are very competent doctors. They're not dumb by any stretch of the imagination. But this is their operating model. They're not going to go outside the playbook that they have. But as a patient, you can't afford that lack of choice. The choice of being bedridden for the rest of your life or being in pain for the rest of your life are not good choices. We got to have something in between. And the only way she could make that choice that she did make in the end is to have our platform available to her. So what I'm trying to say on all this is patients have become too used to giving up all autonomy, all control, and they just have gotten used to being treated like sheep. And we have fundamentally altered that already. So then subnets like Care Trial, which is we call a Care Trials network, or the Global Telehealth Exchange that we are working on, or other type of second opinion networks, these are all just different subnets on the Care platform, which each of them serves a different purpose. But you can join one of them, you can join all of them. You just download the Care Wallet, choose a subnet, join it, and you're in connection with the best doctors or the best treatment plans or the best options in the world that you didn't even know existed. And best of all, you are in control whether you want to do something or not. And even better, the Care platform never asks you for your phone number or your email or your name. It never knows who you are. You are always 100% anonymous.
Mm.
It's your choice to tell the other side whether you want to reveal your identity. You can do everything. Get your medical records reviewed, get your x-ray checked by a doctor in Australia, have your MRI reviewed by a doctor in Tanzania if you wish, and they don't need to know your name because the wallet preserves your identity. So those are the kind of things that healthcare simply doesn't do. As I said, but Bitcoin made self-custody finance possible. We are making self-custody healthcare possible. And the number of solutions on our platform is only limited by the imagination of people who want to build subnets on it. But we ourselves have built enough subnets that people around the world are really excited and signing up. So the simple answer is either build a solution or use a solution. Your
Yeah,
choice.
very well said, Pradeep. Use a solution, build a solution, or use a solution. And look, let's just dig into some of the specifics then really quickly. We'll go through them. So you mentioned the care trials, there's a solve token, and there's a care chain. So maybe we start with care chain. Just, yeah, kind of nutshell that and what the status of that is at the moment. How's that looking?
So the care platform. So I would take you back to my original statement when I started Solve Care, and you will it'll be fun for you to and your audience to hear. When we started Solve Care, and I laid out my vision of building a self-custody healthcare platform, we had a choice: build bottom up or top down. Bottom up meant that we would build our own chain, then we would layer in smart contracts, and we would build some kind of a wallet on top of it, and then slowly and surely there'll be dApps built on it, and eventually we'll get to a healthcare use case. This is how 95% of blockchain Web3 community does their business. They start from the chain and they work up. And I said to the team, we're going to go the other way. We're going to go top down. And I said, what we're going to do is we're going to let the blockchain Web3 industry build great tech. Let them come up with a faster chain than Ethereum, a faster smart contract, whatever. Let them build that. Let's build top down. Let's build what we need to use that chain in healthcare. So let's build the platform on top of the chain. And if you think of it as a stack, let's not build the bottom layer of the stack, which is the blockchain itself. Let's build everything above it. And I said, that way, we are not trying to be a me too. My chain is faster than your chain. My chain smart contracts are smarter than your smart contracts. Let the industry surprise us, and they won't surprise us, but they are going to build cool stuff, and great minds will build great tech. So that's what's happening. I'm super proud of the kind of tech we see people building, be it the transaction speed question, be it the cost of the transaction question being solved, be it the intelligence of the smart contract, be it the oracles. Industry is doing great work. I'm very proud to be part of the blockchain industry, but they're doing such great tech, way better tech than I saw in Web 2 world for a long time. So blockchain tech is really, really good, but it took a while to get there. What we focused on was adoption. I said, let's focus on healthcare use cases and healthcare adoption, and that will come from patient, provider, payer, payment, gas fee. Let's build that whole platform above the chain. So we just used permissioned Ethereum initially, but we invested a ton of money in building the utility and the adoption drivers, which is where you design healthcare business model and business processes and relationships, the wallet, the cards, the medical records exchange, the payment models, and all this very complex stuff. We focused on that. And using Ethereum permission chain, which is what we call care chains one, we launched all this, and we are seeing tremendous adoption, which is exactly what I wanted. I wanted to focus on bringing non-crypto users to crypto. They don't care which chain is running underneath. They don't care, which token is paying the doctor. They just want to use something they can use. So we focused on that whole platform. We built it and we launched it. And on top of that, we are building these subnets, which are now catching fire. And once the industry figures out what our adoption curves are, I think we will shock the entire Web3 industry, because there are a lot of them are solutions looking for a problem. And that's what we didn't want to be. So we built what grandmother needs to use our platform.
Yeah,
Now
I like it.
what we're doing. So now we are doing is we're migrating out care chain 1 and putting in care chain 2. Now, care chain 1 was built on permissioned Ethereum. Care chain 2 will be a much more open chain. And that's when the convergence of great tech that the blockchain community has built with the great adoption platform that we have built happens. And once they connect, this is the moment that everybody has been waiting for. When will real non-crypto enthusiasts come in to start using Web3 and blockchain? Solvecare is worked very hard and diligently and consciously on making that happen. So that brings us to your question about care chain. So care chain is now essentially the layer that we are building or replacing with a new tech based on the best tech in the market. Be it, we have evaluated all the great tech in the market, be it Cosmos or be it Solana or Avalanche or Cardano. We have looked at all the great tech. And what we have come to realize is that all of them have done some things amazingly well and some things not. So care chain has moved very far, very quickly since we announced it, in that we have brought the right tech underneath our platform to replace care chain that we built on Ethereum with a non-Ethereum chain. And later this year, we will open up the care chain to be fully, the typical mainnet scenario that you have where everything is transparent. And all the utility that we already have on the permission chain will suddenly become visible on the mainnet. So that's where we are. But in a nutshell, it's kind of like two sides moving towards each other to find that perfect fit. So it's the docking of the platform coming from the left with all its users and its use cases and incredible adoption. And on the right side, we have the tech maturing enough where it actually can serve the platform. And that convergence is what CareChain project is about, the CareChain 2.
Got it. Thank you, Pradeep. We talked about the fact that there is a token as well. I believe it's the Solve token. Yeah, let's understand a little bit, Pradeep, about how the Solve token is utilized within the ecosystem and yeah, what it's for.
So Solve is very, very diverse token. It has a lot of utility because healthcare has a lot of transactional needs. So Solve token is the gas for any time you, as a patient, send or receive a card to your doctor's wallet, because our system is a card-based system. So everything happens as a card. I send you a card, you send back a card. My card could be a request for appointment. Your card could contain the appointment confirmation. You send me a card as a bill. I send you payment with a card containing the tokens to pay you. So it's a card-based model, right? So we use the word card to mean a transaction between two people or between n number of people. Having defined that, every time a card goes from wallet A to wallet B, Solve token is used as a gas. Every time a card goes from wallet A to wallet B as a payment, Solve is used as a payment in addition to a gas. Every time identity is exchanged or eligibility information is captured or campaigns are run or enrollment is managed or third parties are paid for fees or subscriptions are offered and subscribed to, Solve token is the vehicle. So Solve is a very diverse utility token in that it is utility on Care platform, but it does basically everything that dollar would do in the real world. Whether you're paying for gas, you're exchanging records, making an appointment, getting a bill, paying a bill, verifying to the doctor your identity, enrolling in a program, subscribing to a campaign or a subscription, launching a campaign, all those functions that need to happen in the real world are powered by Solve as the token. So that's one thing. So when it comes to token design, Solve was designed from the ground up as a real world token that doctors, patients, insurance companies, pharmacies, labs, and every other human being on the planet in any role would use to transact healthcare data, healthcare identity, healthcare transactions, and healthcare payments. And of course, underneath that, Solve is gas for the whole platform. And what's really interesting is because Solve is fixed supply, it can be mined. As more and more subnets are being launched and they all use Solve in one capacity or more, it's basically a very finite quantity token with a very fast growing demand. So, which was our goal, that Solve should become the de facto healthcare currency in the world. If a patient in Tanzania wants to have their medical records or their X-ray reviewed by an oncologist in Tennessee, the way that happens is with the help of Solve. Because the Tanzanian patient is not going to be able to go to Tennessee and do this. So to build a global healthcare self-custody solution, to build a global self-custody healthcare chain, You got to break all boundaries and all barriers, and solve is the only way you can connect patients' needs to a doctor's need to get paid.
Got it. Thank you, Pradeep. You mentioned before care trials, and I think you said it's your first public network. So maybe let's just understand a little bit about how care trials can support participants, going through their healthcare journey, I guess, and also understand how care trials can be used to support healthcare professionals and researchers, I suppose, in the healthcare industry.
So care trials is our latest solution on the care platform. And as I said, you can come and build your own. It's either build it or use it or both. So care trials is a revolutionary two-sided marketplace that simplifies the process of matching human beings with clinical research around the world. And it's truly the culmination of all the great tech we built and other people have built to allow for a patient to anonymously browse and select and learn about clinical research that can benefit them or their family. And it uses the most advanced tech, both in terms of blockchain and zero knowledge proof, but also incorporates artificial intelligence-based matching of the patient's need to the best trial in the world. And the economic value is enormous. The first fundamental value of care trials is let's cure cancer faster. We haven't found a cure for cancer. And for the reason for that is economic. The research for cancer is centralized, controlled, governed, and very, very few people participate in it because one, they don't know about it. Second, they are disincentivized to participate. So both lack of knowledge and lack of transparency is slowing down the cure for diabetes, cure for cancer, cure for hypertension. And if you look at the trends, 4 billion people are set to suffer and die from the top 20 chronic diseases over the next 20, 25 years. So we're going to let all these people go through a painful departure from this earth when we could accelerate their care by accelerating research. And research, as we know, is very, very centralized. Not only that, connecting patients to doctors or to researchers is a $40 billion a year problem. Pharma pays more than $40 billion a year to researchers to find the right patient and conduct the research with. And it doesn't work because every doctor has a finite universe of patients. And if you are unlucky enough not to be with that reputable doctor, you're never going to hear about the research. Like my mom didn't. She didn't know anything about the spinal care options for her. Even though she goes to the best hospital in the Northeast, they didn't tell her about it. And she found out through our platform within 1 minute that she really has a better choice than surgery. She may have to wait 3-6 months, but a hell of a lot better than lying in your bed for the rest of your life or passing away 5 years sooner, because your mobility is your life. And you take that away, people die. So we're talking about a $40 billion a year problem that care trials addresses in terms of economic problem. But in terms of human problem, it's an $8 trillion a year problem. Because majority of healthcare spend that we have each year, which is about 8 trillion worldwide, majority of that goes to chronic disease care. And why are we not fixing these chronic diseases? How is it that we have so little progress on cancer and on hypertension over the last 20 years? Why is the velocity of research slow? And the reason for that is a very centralized, ineffective, inefficient research model. How can a smart independent researcher even get their research noticed? Not going to get noticed. Unless you work for big pharma, you're not going to anywhere be in the picture. So our job is to decentralize research for the betterment of humanity. So we build care trials as a mission statement that if you're going to talk about self-custody of care, you're also going to talk about self-access to care. And what better place to start than to give my mom and your mom access to the best cutting edge research so they have better choices than what they'll hear from the conventional hospital or physician. Not to say they don't do a good job, they do, but they don't know everything. You should have more choices. So that's what care trials is. And what's really exciting is that we launched care trials in November, October, November. It's already, we have patients in 58 countries that have already signed up for care trials. And it's a growth curve that is amazing. It's both on the demand side, patient side, and from the supply side, researcher side. We are seeing significant traction and enrollment from real world. And these people don't care about the fact that this is crypto, blockchain, solved token. They just care about the fact that Scare Trial solves a huge problem in their life, like my mom. So we are seeing this growth curve on care trials, but all that growth curve is happening on the care trial subnet. When we migrate that platform to CareChain 2 with its own mainnet, then the whole industry, I think to a certain degree, the whole Web3 and blockchain industry will be shocked with how much utility and value there is actually already there. It just needed to migrate onto the new tech, if you will. There are also, to put things in perspective, there are over 100,000 research sites active at any given time, all looking for patients. But we don't know anything about these sites. Where do you find out about them? You have no place to go and figure out what's a reputable site where you can get a trial, where you can participate in research that might be relevant to your mom or to yourself. And are they really safe? Do they have any sanctions against them? So Care Trials addresses all those issues. And the blockchain protects both sides. And the patient never, ever have to disclose their identity till they really decide that I want to be part of this research. They are totally anonymous. Their data is never shared in a way that the trial site can spam them or email them or sell their information. Not a so it's a revolutionary thing, as we say. We're very excited about it. And the traction in the 50 plus countries that we have currently patients downloading the care trials, it's remarkable. This is really fantastic.
Well, fantastic to hear, Pradeep. And look, as we start to finish off, I'd love to just kind of zoom out a bit, perhaps, and talk about, what you see happening more broadly in terms of, Web3 trends, if you like, or healthcare trends, if you like, or a little bit of both. Like, one thing I've observed, Pradeep, is you sort of learn as you get older or you have an experience with the healthcare system that it's very vitally important to advocate for yourself because no one else will. And if you have a mother or a daughter or a son or a partner or something, you have to advocate for them if they're not a little bit compromised. And it's really important to do that. But one of the ways that people can do that for themselves before they even get into the healthcare system is today it's much easier to access information. It's much easier to educate yourself on what you should be eating or what you should be doing to exercise and take care of yourself, even down to the level of what are the nutritional supplements you could be taking. Some of them are experimental. There's a whole lot of experimental supplements like peptides that are kind of at the cutting edge of maybe kind of healthcare influencer science, if you like. But, eventually these kinds of things will be perhaps adopted by the more traditional healthcare system. But I guess what I'm saying, Pradeep, is, I think it's exciting. It's just the democratization of information now. Some of it's good, some of it's not good. But yeah, curious as to the kind of trends that you're observing in Web3 and healthcare at the moment.
Well, I think you're absolutely right. From our point of view, we have worked, quietly and under the radar, if you will, to build real utility for patient autonomy, patient rights, and real-time payments that blockchain facilitates. And we've really focused on achieving that use case that healthcare can benefit from, that patients can benefit from, and that healthcare needs. So where I see us now is that we have, instead of first building the tech and then looking for a use case, we built the use case, we improved the use cases, and now we are merging it with the latest advances in tech. I think that was a really good decision because there's so many other great tech looking for a problem to solve. We solved the problem and now we can upgrade the tech. So that I think worked out really well, which is So we are very excited about the adoption that we are seeing because people like my mom and your mom and our families need those options. They need a different model. And it doesn't matter what the government model is in place in your country is. That's fine. Nobody is saying that that's broken or it's not optimal, but it is what it is. But you need to have optionality. You need to be able to say, well, this is what my doc said, but what does a different doc have to say? Why would we as a patient not want to have choices and transparency and the right to make our own decisions, even when government is paying the bill? So in that regard, I think our platform is proving to be relevant everywhere in the world. Because initially when I started SolveCare, people said, oh, this is a US only problem. It isn't. Cancer is not a US only problem. Diabetes is not a US only problem. Having an old parent is not a US only problem. It's a human problem. And so that's where we have seen. And what we are really seeing also is that, really major players in healthcare, like I was recently listening to Brian Armstrong, the Coinbase CEO, talking about how healthcare and science and blockchain need to come together. And there's a lot of conversation about decentralized science, which is really about building open marketplaces for research, is what that boils down to. And then you have projects like SolveCare, which are really driving huge adoption from real world patients, which when they come on to the blockchain universe, suddenly give blockchain true legitimacy. Because otherwise, the non-blockchain world is saying, what is the blockchain for? They don't really understand this potential till you give it to them. And SolveCare is the one that's delivering the blockchain potential to them. Then you got, the patient identity and autonomy thing, which is, do I need to sacrifice my identity and my rights just so that the doctor will agree to see me? I think we need to change that equation. We already have in the context of trials. We are the only network on the planet where the patient decides which trial they're going to participate in. Every other model on the planet is the doctor decides which trial you are eligible for. And if I don't think you're eligible for, you're never going to find out about that trial at all. We flip the model. Let the patient choose. Let not the doctor can still determine eligibility, but you as a patient should know about every trial that's happening around you. And the doctor should know nothing about your identity. You should be the one who should be able to say, I like that trial. Let me take a look dig into that deeper. So we are flipping the model upside down. And that's what it's going to take. And that's why we have this adoption curve that we are seeing. And I think 2024, we're going to demonstrate to the market, both crypto and Web3 market, what real adoption looks like, but also to the healthcare, what blockchain can do really for patients. So it's that, again, I'm glad we focused on the real utility and real adoption, and our brethrens and innovators in blockchain built the great chains. And now it's the merger that unleashes the true power.
Yes, indeed. Exciting stuff, Pradeep. All right. Well, look, as we finish off, just tell people where they can go to learn more about SolveCare, how they can get involved, how it all works. Yeah, what is the best place for people to go to?
So easiest answer is download the Care Wallet and join one or more of the networks that are already on the Care platform, on the Care chain, and see which one of those benefits you and your family. It's super easy, it's free, and your identity is yours. You will see that at no point anybody can find out anything about you, but you can find out everything about what you need to know. And more subnets or networks are going to be launched by us and by third parties. But definitely join the Care Trials Network, which is right there when you download the Care Wallet, and it'll ask you if you would like to join Care Trials. And every month or so, we're going to be pushing out more different solutions on the network, on the platform. And many of them that have already been built will migrate to the new chain. So you will have a lot of choices, a lot of utility, a lot of different use cases in the Care Wallet. And it doesn't matter if you're young or healthy, old or multi-chronic, or you're taking care of a parent or a child. Doesn't matter. There's something for you there. So I would say download the Care Wallet. This is my first thing, advice to you. Second, join our community. Come to Telegram, look up solve.care. We have a very active community, a couple of 100,000 people who are continuously engaged. They're talking all the time. And the third thing I'll say is if you have a problem that you're struggling with, or you want to change healthcare in any way, big or small, then come talk to us and let's build a subnet together, or you can build it yourself and change healthcare in your universe, wherever you are, in Tanzania or Tennessee, doesn't matter. So either use the wallet and use one of the existing networks, or build a new network and we'll help you do it. We'll show you how to do it, or you can teach yourself. It's pretty easy. Or just join the community or do all of the above.
That is exactly what you should do, folks. And of course, links to the community and the websites are in the show notes. Thank you so much for joining us and spending some time with us today, Pradeep. It was a pleasure to talk to you and wish you all the best. And yeah, let's change that health system. All the best and bye for now.
Absolutely. Thank you, Andy. And thank you, everyone listening. I really appreciate the opportunity to talk to you. As you all can see, I'm very passionate about leaving a legacy here that we can be proud of. And all you have to do to be part of our legacy is to decide that enough is enough and we're going to do healthcare differently and be part of the journey. So thank you for giving me the opportunity.
Awesome. Thank you, Pradeep, and bye for now.
Thank you.
All right, there you go. That was a Pradeep from, selfcare, the Solve Foundation, Solve Token. Yeah, bringing blockchain to healthcare and trying to help people in those healthcare systems all around the world. Man, healthcare sure needs some tidying up, doesn't it? All right, well, we reach the end of another show, folks. Thank you so much for listening. Thank you so much for watching. We'll see you here real soon for the next episode. This was the Crypto Conversation for Brave New Coin. See ya.